Well, here at home, we are still waiting for it to be delivered to a dozen facilities, including Baptist Hospital. And that's where we find On Your Side's Troy Kless tonight, who spent the day pushing for delivery, answers about delivery and who is scheduled to get the vaccine. Troy?
Yeah, thank you, Heather. Well, people here at Baptist Health telling me that they're going to be expecting the Moderna vaccine sometime today, but we're not able to pin down a definitive time of arrival. But again, still some optimism there, and that delivery might be handled a little bit differently compared to when they received the Pfizer vaccine last week. Now, the Moderna vaccine can be refrigerated for a longer time, which again, doctors say it might mean that they might be able to hold on to that supply for a little longer, and thus meaning that more people will be able to get it, hopefully.
A pandemic with an ending in sight. Dr. Michael Korn is the principal investigator for both the Pfizer and Moderna vaccine trials right here on the First Coast.
I was vaccinated last week, and I feel terrific.
Dr. Korn saying he's practicing what he preaches and has seen very similar results in both trials.
So when you look at the documents, you see that about 10 days after getting the first dose of the vaccine, the risk of getting COVID is close to zero.
He says the message is to get that second dose, given 28 days apart for Moderna. The second dose may give a mild reaction like muscle aches, low-grade fever, he says. A Baptist Health spokesperson says they expect 1,000 doses to be delivered this week. Dr. Vincie Samuel, Director of Employee Health, says supplies are critical to protecting frontline workers.
At this time, it's really based on what's available. So whichever one is available is what we're going to be using and administering to our healthcare workers.
Dr. Korn estimating early spring before the vaccine becomes widely available to the public.
The FDA gave the emergency authorization based on 2 months worth of data. So in another 3 months or so, we should have the 6-month data and be able to more broadly distribute it in terms of different healthcare facilities.
He says the difference between Moderna and Pfizer is not noticeable to the consumer, but both offer critical levels of protection.
Basically, there's only 2 ways to become immune to COVID-19. Either get the vaccine or get the illness. And I know what I would rather do.
Now, Dr. Korn says the trials did not involve anyone that had allergies to the current vaccines, and he recommends that if people are still having questions, that to talk to your doctor or healthcare provider about weighing the benefits of this as well. We're live in downtown Jacksonville. Troy Kless, First Coast News, On Your Side.